Welcome to a presentation on pneumonia brought to you by your neighborhood doctors. Please remember that we will cover the topic in general terms. Please consult your doctors for specific questions pertaining to you. Pneumonia is like a fire in your lungs. It starts with a spark, which can be caused by a virus or bacteria. The spark ignites and spreads, causing inflammation and fluid buildup in the air sacs of your lungs. This makes it hard to breathe and can cause chest pain, fever, and coughing. Just like a fire needs to be put out with water, pneumonia needs to be treated with antibiotics to help your body fight off the infection. Pneumonia is an infection of the lungs that can cause a variety of symptoms. Common symptoms include chest pain, fever, chills, shortness of breath, and a cough that produces mucus or phlegm. You may also experience fatigue, loss of appetite, sweating, and headaches. In some cases, you may have difficulty breathing or a rapid heart rate. If you have any of these symptoms, it is important to seek medical attention right away. Pneumonia is a common condition that affects people of all ages, genders, and backgrounds. It is most common in young children, the elderly, and those with weakened immune systems. People who smoke or have chronic illnesses, such as asthma or diabetes, are also at an increased risk of developing pneumonia. People living in crowded or unsanitary conditions are also more likely to contract the disease. Pneumonia is an infection of the lungs caused by bacteria, viruses, or fungi. It can be caused by a variety of factors, including exposure to certain chemicals or environmental pollutants, smoking, and weakened immune systems. In some cases, it can also be caused by a virus or bacteria that is spread through the air when someone with the infection coughs or sneezes. In other cases, it can be caused by aspiration of food particles or liquids into the lungs. Treatment for pneumonia depends on the type of pneumonia you have and how severe it is. Generally, treatment includes antibiotics to fight the infection, rest, and fluids to help loosen mucus in your lungs. If you have a mild case of pneumonia, you may be able to treat it at home with rest and over-the-counter medications such as ibuprofen or acetaminophen to reduce fever and pain. You should also drink plenty of fluids to help loosen mucus in your lungs. If your pneumonia is more severe, you may need to be hospitalized so that you can receive intravenous antibiotics and oxygen therapy. In some cases, a breathing machine may be necessary if your lungs are not able to get enough oxygen on their own. In addition to antibiotics and other treatments, it is important that you get plenty of rest while recovering from pneumonia. This will help your body fight off the infection and heal faster. The prognosis of pneumonia depends on the type of pneumonia, the severity of the infection, and the overall health of the patient. Generally, most people with pneumonia recover completely with treatment. However, some people may have complications that can lead to long-term health problems or even death. People who are elderly, very young, or have weakened immune systems are more likely to have complications from pneumonia. It is important to follow your doctor's instructions for treatment and take all medications as prescribed. This will help ensure a full recovery and reduce the risk of complications. Thank you for listening to this presentation brought to you by Talking Raymond. For information, check us out retinally.com/info. Be safe. Love you.